Well, we are continuing our special series, Discover Black Heritage, all month long. And today, we're focusing on health. Now, research from the National Institute on Aging shows the risk of developing Alzheimer's is higher in Black Americans. This is compared to their white counterparts. Stephanie Monroe with the Alzheimer's Clinical Trial Consortium explains that there are some steps Black Americans can take right now to reduce their risk.
Yeah, we understand now through the research that's been conducted that adopting risk-modifying strategies can actually help prevent potentially as much as 40% of Alzheimer's disease, or at least lower the risk. These strategies include adopting a heart-healthy lifestyle, watching your nutrition, green, leafy vegetables, setting up a plate that has a lot of color on it so we make sure we're getting a good mix. Adequate sleep, at least 8 hours a night, good clean water, a lot of hydration during the day, staying brain active, staying engaged with other people, having those kinds of social interactions. All of these things, including exercise, at least 15 minutes a day where you get your heart rate up, seem to be very helpful with healthy aging and keeping your cognition where it needs to be.
I know you're working on a clinical trial. It's underway right now, specifically gearing towards helping slow the progress in Alzheimer's. Talk to me about that study and the biggest challenge that you're all seeing with that.
Well, the AHEAD study, which people can get more information going to aheadstudy.org, is really exciting, as we have learned through other clinical research and studies about what people need who are beginning to have brain changes, which can actually start 20 years before a person gets the first symptom. So what we're trying to understand is there a way for us to address these brain changes before symptoms in older and younger populations, and what's the difference between that? What's our dose look like, and the time when these medications and the type of medications that will work? We've recently had lecanemab, which is a drug that was recently approved by the FDA to be safe and effective in use in all populations, which was given to people who are older, 65 and older. So we're now going to increase that and go down further, about 10 years, to look at people aged 55 and older to see, can we get the same type of an impact on people before they develop full-blown Alzheimer's disease or even symptoms of cognitive impairment? So we're trying to prevent Alzheimer's disease altogether. We're trying to slow the progression of Alzheimer's disease to give people longer, more time to live a healthy lifestyle. And hopefully these types of research will help us one day find a cure.
And if you would like to watch that entire interview, you can find it online at NBCBayArea.com and also on Roku and Amazon Fire TV. We've also posted a link with more information on our website as well.